Dear students, welcome back. In this session, we are going to discuss about subtalar joint. This is also called as Talo-calcaneal joint. This is the talus bone and this one is the calcaneum. The joints form between the talus and the calcaneum. And here, why it is called subtalar means the joint which is found below the talus with that of the calcaneum. So it is called as subtalar joint. Actually, there are three joints. One is posterior, and then anterior, and the medial aspects between the talus and the calcaneum. So the posterior joint is named as Talo-calcaneal joint. Only the posterior one is called as Talo-calcaneal or subtalar joint. Okay. The anterior joints or the parts of Talo-calcaneo-navicular, and all these joints which are actually placed in front of the head of the talus and not below the talus. So we are not considering the remaining joints as a subtalar joint in anatomical terms, but in the case of functional terms, we can consider all these three joints together as subtalar joints. Okay, so we are mainly concerned about now posterior Talo-calcaneal joint, that is called as subtalar joint. Okay. This one is a synovial joint, plain or gliding variety. The articular ends below by the articular facet of the upper surface of the calcaneum, which is slightly convex, and above the concave facet. Here you can find the talus which is having a concave facet, okay, on the inferior surface of the body of the talus. These are the articulating surfaces of subtalar joint. If you see the ligaments are capsular ligament. It completely covers the joint and its inner surface is lined by synovial membrane. And next one is the lateral talocalcaneal ligament. Lateral talocalcaneal ligament which is present on the lateral side. This one is the medial aspect. This diagram represents the medial side of the right subtalar joint. Okay, this lateral talocalcaneal ligament extends from the lateral tubercle of the talus to the lateral surface of the calcaneum. Okay, if you see the medial talocalcaneal ligament, it stretches from the medial tubercle of the talus to the sustanculum tali, like this. Okay, and interosseous talocalcaneal ligament, it stretches between the talus and calcaneum. It stretches between the talus and calcaneum. Okay. So this is about the ligaments of the subtalar joint. We see the movements permitted at these joints are the inversion and eversion movements. What are those? Inversion and eversion movements. So this one is inversion and here this one is eversion. Okay. So these are the movements which are taking place, and this is the axis of the movements of the inversion and eversion. So on this axis only the inversion and eversion movements taking place at the subtalar joint level. The muscles which helps in inversion or tibialis anterior and tibialis posterior, and eversion which the muscles which helps in eversion are peroneus longus and peroneus brevis. For inversion, tibialis anterior and tibialis posterior. Okay, so these are all the movements which are taking place of the subtalar joint. Thank you.